Phalens test, also called as Phalens sign. It is a test done in patients who complains of weakness and pain and numbness in this area of the hand. That is the lateral 2/3 of the hand, palm of the hand, lateral 3.5 fingers, that is thumb, index, middle and half of the ring finger. If they have some tingling and numbness in this area and weakness of the muscles of the thumb, we do this test to test whether there is any compression of median nerve. In this Phalens test, we ask the patient to touch the back of the hand to one another. The fingers should be pointing downwards. This position has to be maintained at least for 30 to 60 seconds with pressure. So once the patient is able to maintain like this for 30 seconds, and if they don't feel any pain and numbness in this area, the lateral 2/3 of the palm, lateral 3.5 fingers, that means their median nerve is not compressed in the carpal tunnel. If at all they feel some pain, tingling, numbness, pricking sensation, altered sensorium in this area, that is the lateral 2/3 of the palm and lateral 3.5 fingers, including the thumb, index, middle and lateral half of ring finger, that shows the sensory distribution of the median nerve is affected. Some of the patient complains of weakness in the opposition movement, that shows thenar muscle involvement. So this Phalens test is a test to detect compression of the median nerve within the tunnel called as carpal tunnel, wherein the dorsum of the hand, that is the back of the hand, is pressed against one another and fingers pointing downwards. This posture has to be maintained for at least 30 to 60 seconds. Now let's understand what is this carpal tunnel. The carpal bones, that is scaphoid, lunate, tricutal, pisiform in the proximal row, trapezium, trapezoid, capitate, hamate in the distal row. They form a concavity. Okay, all these 8 carpal bones form concavity. The upper or the superior aspect or the anterior aspect of this, there will be 2 centimeters band thickening, that is flexor retinaculum. Now this carpal bones, now with the flexor retinaculum, it's converted into a tunnel called as carpal tunnel. In this carpal tunnel, the long flexor tendons of the forearm will travel and including this nerve called median nerve. If any problem of the tendon or the carpal bone or thickening of flexor retinaculum or even myxedema or thyroid disorder, it can compress the median nerve within this tunnel, resulting in carpal tunnel syndrome. Thank you for watching and learning from Logic Medico.